It's the Brian Lehrer Show on WNYC. Good morning again, everyone. Now we're going to turn to a new study about cannabis use from the Journal of the American Medical Association, which found that weed products may be more addictive, keyword addictive, than previously thought. You probably know that legalization is on the rise in the U.S. Most states, including New York and New Jersey, have legalized recreational use, and almost all states have allowances for medical marijuana. And with the growth of the legal industry, weed has been billed as a healthier and less addictive alternative to alcohol. The numbers show that Americans have been buying into that pitch. A lot of people think of popping a cannabis gummy or using a weed vape as healthier and less addictive than having a drink. The study we're talking about today, this is not about going back to illegal weed, but it showed that 26% of adult men reported using the drug in the past year, up from 22% 5 years ago. For women, it's gone up to 22% of women using it in the last year from 18. But about a third of the people who use cannabis showed symptoms of what researchers are calling cannabis use disorder, suggesting that it may be, they say, it may be even more addictive than alcohol as a percentage of users. One reason, perhaps, that's speculated on is that cannabis products are a lot stronger than they used to be, so we'll dig into that aspect, among other things. Joining us now is Roni Caryn Rabin, a health reporter at the New York Times, who just wrote a piece with the headline, "As More Americans Turn to Cannabis, Problem Use is Increasing." Roni, thanks for joining us for this. Welcome back to WNYC.
Thank you for having me.
So give us the prevailing wisdom about the addictive properties of cannabis until now. Why have researchers said for so long that it's not addictive? I guess the word addictive is different from you can become dependent.
Well, I think that there's always been some dispute about this. We're talking about something called substance use disorder. That's the current term. I think that we used to think it wasn't very addictive. It wouldn't lead to this. But the products today are very different than they used to be. They're much stronger. They're obviously easier to get a hold of. They're everywhere. It's ubiquitous. But the prevailing wisdom is that it's the dose that drives the habituation, and that the concentrations of the potency of products has just grown immensely. There's a lot of controversy about that, but I like to just look at the National Institute of Drug Abuse looks at products that are tested by law enforcement seizures, and they've seen the potency of Delta-9 go up from about 4% to about 16% between 1995 and 2022. So that's a fourfold increase.
On cannabis use disorder, if someone uses cannabis on a daily basis, let's say, does that inherently qualify as a disorder or problem use, or does that definition more have to do with the negative effects on someone's daily life if it's having negative effects?
No, I don't think daily use alone doesn't qualify. There's actually a very clear list of 11 symptoms that the DSM put out by the American Psychiatric Association. That's the Diagnostic and Statistical Manual of Mental Disorders. There are 11 symptoms. Daily use is not on them, but the main theme is it's causing problems in your work, in your social life, in your interpersonal relations, or causing danger or some kind of problems you want to cut down, you want to quit, and you can't. That's kind of the general idea. And within that, there are very specific symptoms. Giving up other activities or hobbies or time with friends to use cannabis is one of them. Another is using cannabis in situations with the risk of injury, like driving. So if you have, there are 11, they're really easy to search on Google. I know people asked us a lot about this after the story ran. If someone has 2 or 3, they're considered to have a mild cannabis use disorder, and moderate use disorder with 4 or 5 and 6 or more is considered severe.
listeners, we
So
can
it's not
take
just daily
your
use.
calls on this. You can talk about your own experience. Do you think that you suffer or have suffered from cannabis use disorder? Did you start using more or higher amounts and then realize you needed to change something? Have you ever felt addicted, using that word, to cannabis? 212-433 WNYC 433-9692, or maybe you know someone who has. 212-433-9692, or just questions for our guest who is reporting on the addictive properties of cannabis and the increasing prevalence of cannabis use disorder. Call or text 212-433 WNYC 433-9692. Roni, let's get into the demographics a little bit. First, by age. Adults age 35 to 49 are among the fastest growing population of weed users I see, percentage-wise. So what's going on with that generation in particular?
Well, it's really interesting, and it's really disturbing to a lot of the researchers who follow this, because that's usually a time of life when people are kind of settling down and having families, having children, and they're not using as much, and that's where we're seeing the growth. The lower ages, the young adults, 18 to 30, that hasn't actually grown that much. It was already high. But this is where we're seeing a lot of the increase, and people are concerned for a lot of reasons, including the fact that, of course, as people get older, their brains are aging anyway, and we don't know what this will do to the aging brain. There are concerns. There have been some epidemiological studies out of Canada, and these don't show cause and effect, but they do show a higher risk of dementia among older people who are coming to the hospital a lot for cannabis use disorder. And we're actually seeing a lot of long-term health effects that we never really had a chance to study or observe, because people wouldn't answer honestly about their cannabis use, and we're also just seeing, so much more of it. It's everywhere. So we're seeing lung issues for people who smoke. We're seeing this vomiting syndrome, called hyperemesis syndrome, abdominal pain that people can get after a lot of use. We're seeing some concerns about earlier onset increase of schizophrenia and psychotic episodes, and also just a general increase in death rates among people who have cannabis use disorder. Just a higher risk of death and concern about cardiovascular disease and stroke. So it's all over in terms of the health concerns.
I think I'm seeing a gender disparity in these stats. More men than women affected by cannabis use disorder.
Yeah, absolutely. More use among men, more cannabis use disorder, and more of the severe cannabis use disorder.
So is one of the
I think
takeaways
that's
from
similar
that?
with alcohol.
More men with alcohol use disorders.
Yeah, I think that's always generally been the case.
So with that long list of particular risks from people with cannabis use disorder, does it associate with a certain amount of use, either, per week or per time they use it, like higher doses, or, how can you break down any of those? And I know you said there wasn't cause and effect that's been demonstrated, but a lot of association in the epidemiological studies. Can you get any more specific on that about what kind of use leads to any of those particular risks?
Well, cannabis use disorder would suggest frequent use, and because one of the symptoms is also growing tolerance and craving more, it would suggest higher use, even more frequent use and more potent products. And unfortunately, we don't really have that much research to pin it down that carefully, and there's individual variation. But and that's one of the issues, is that we kind of let the horse out of the barn, and we didn't really have that much information. And it's still very hard to study, because it's still, even though they're loosening regulations, it's still a controlled substance, and it's been hard to study in the lab. Researchers complain it's incredibly hard to do research still, because it's still seen as a controlled substance.
David in
So
Brooklyn,
we
you're
don't
on
have the specific.
WNYC. David, hello. Oh, I have to click on your line to actually put you on the air. My fault. Hi, David. Now we have you.
Hi. Yeah, so I smoked since I was quite young, like in high school, even before. And then somewhat recently experiencing a life-change divorce and actually having a new partner, I'd been told that I would get kind of like, I'd get positive, but then get kind of angry and negative after smoking or even eating cannabis, and that I needed to try to stop because of this sort of negative, I get maybe a little paranoia, bitter. And I did about 5 months ago, and I can't say I'm totally not still, but I do think I feel a little bit more clear and grounded. And again, like initially I always feel better though when I smoke, but then later something else happens with me psychologically, and it was troubling other people as well, and also my son a little bit. He was 11, you know.
David,
So
thank you for being open about that. Openness about such problems always helps other people who might have. This is not to say everybody who uses cannabis has this problem, but people who do, it's probably liberating, or makes you think about yourself more when you hear a caller like David. Lauren in Williamsburg, you're on WNYC. Hi, Lauren.
Hello. Just pulling over, sorry. So one thing I thought about when you first were talking about the study is increased use is now when you go into a dispensary, especially they have like a lot of gummies that have a lot of different derivatives. So you can get something to help you sleep, or you can get something with anxiety. And I wonder if that has increased use. Just instead of people going to their doctor and getting a sleeping pill or getting something for anxiety, if people have kind of gone to that because they feel like it's a little bit safer than using a prescription drug. So I feel like some people have also just changed now that they can go to a dispensary and get more guidance. They may be using that versus going to a prescription.
Lauren, interesting. And the dispensaries are selling. Have you reported on this? Like the main, different gummies or whatever, where the main ingredient in cannabis, THC, is mixed with other things. Like Lauren talked about using it for sleep, and I've read where you can get gummies that are THC with melatonin, and there are other cannabis derivatives, THC with CBG or CBC, as well as CBD, which a lot of people are familiar with. So, and I guess from what she says, they'll tell you specific uses. So how does that affect anything that you've reported on?
Well, I haven't looked specifically into the different formulations, but this is a huge market. There's a lot of marketing that's driving all kinds of different products, a whole variety of things. And CBD products are very popular, but they often may have some THC and not be labeled well. One of the concerns is that the labeling isn't always accurate, and that we need some
CBD
regulation.
by itself doesn't get you high, so that's sold in all kinds of regular stores, right?
Yeah, and just think about it. I mean, in terms of what's available for people, there were many people who didn't smoke when they were younger because they didn't want to smoke anything. But now you've got gummies, and you've got liquids, you've got drinks, you've got all kinds of products.
Let's take another call. Janet in Crown Heights, you're on WNYC. Hi, Janet.
Hello. I'm concerned about how do we really know what these companies are putting in the products. And just like we've been learning about processed food, people sometimes feel that they put products to make you want it more. So I don't know what kind of regulation they have about these products. And, you buy it and you just don't know. So I try to regulate myself and not overuse it. Thank you.
Thank you. Well, are there, like Massachusetts, currently has a referendum that people are going to vote on in November, Roni, I'm sure you know, that would repeal their legal recreational use. It seems like it's probably headed to defeat, so they'll keep legal recreational use, but we'll see what the actual outcome is. But that caller raises specifically regulating as opposed to banning the products in more specific ways, so maybe it becomes more transparent to people what the different ingredients might do to you or risks of use disorder. You have anything on that? Are you seeing anything like that?
Well, I know that we ran an op-ed by Dr. Kalia Murthy talking about use in youngsters and teens and adolescents, and he called for some very specific reforms, including potency caps on the amount of THC in products, making it more like alcohol. I mean, alcohol, you know exactly what you're getting with different types of alcohol. It's regulated. Also, labeling, health labels, talking about mental health warnings and other side effects. Again, like we have with tobacco, and we have some on alcohol, not a whole lot. And I know that the National Institute on Drug Abuse director, who I interviewed for this piece, NurPhoto, also made the distinction with alcohol. And obviously, we have a lot of problems with alcohol in this country. It's much more widely used, even with the drop in drinking. There are many more people with alcohol use disorder than with cannabis use disorder. But you do know what you're getting. It's standardized and it's regulated, the amount of alcohol in every kind of drink. And some people think we need that.
So is the pitch that weed is a healthier alternative to alcohol true at all? Is it a positive alternative for some people? Can it be measured?
Oh, gosh. That's the $1 million question. I don't know that I can answer that. I mean, we know that alcohol can cause a lot of end organ damage that's very severe. I mean, high alcohol use can be extremely damaging to one's health and kill you. We know that withdrawal syndromes with alcohol can be much more severe. So but I think it's a difficult comparison. I don't think we have all the evidence yet for cannabis. I think we know a lot more about alcohol's harms.
Mm-hmm. Stephanie in Orange County says she's a psychiatrist writing a book on cannabis use disorder. Stephanie, you're on WNYC. Hello.
Hello. Thank you so much for writing this article about cannabis use and making the public more aware. I think some of the problems in the past have been with the scheduling of cannabis, which is one of the reasons why we don't currently have a lot of research on the longitudinal effects. Since the scheduling has changed, we have more research on it in the medical literature. We are finding out that there are a lot more areas of the brain that have cannabinoid receptors than other substances of abuse, and that could be one of the reasons why we're finding that more and more people have problems with dependency. The other is, there are a lot of organic solvents that are added, which increase its lipophilicity, so they're taken up more rapidly and into the cells of the brain, which make something that we ingest more addictive. The other thing is the areas of the brain that get down-regulated are the ones where we monitor error. So people might use and not realize that it's having deleterious effects on their life. So they don't have insight into that. And also the reward center of the brain is kicked up. That also causes a lot of dysregulation from areas of the brain such as the amygdala, which we need for regulating anxiety, feelings of depression, And we see a lot of people now with panic disorder and severe anxiety from regular use. The other thing is that I think it's, we're trying to qualify the amount of use. I think research is suggesting that people who use 3 to 4 times a week is considered highly problematic. And that has to do with the half-life of cannabis and how it's metabolized and then leaches out of the brain. So,
Stephanie, I'm going to leave it there. You put a lot of stuff on the table. You're obviously looking into this at a level of detail. I don't know if there's anything you want to react to in that and whether it has any implication for further research or for policy, Roni?
A number of things she said were very interesting. And cannabis also stays in the body for longer than alcohol. I want to respond to something earlier caller said about anxiety, and this phenomenon has been noted where people use cannabis to help with their anxiety. It does calm them initially, and then over time, it stops working, and their anxiety can increase with use. So that has been documented. And I just wanted to also say about medicinal uses, so much of this is falling under medical uses. But I wrote an earlier piece where I looked at what the evidence was for the various uses. I mean, each state has its own list of medical uses. Illinois has 56 different things that you can use cannabis for. But the best evidence, and it's also not great, is for pain. A lot of the other uses don't really have a lot of evidence behind them yet. So, but fascinating caller and how it works on the brain. And this is stuff we're still learning.
Before we run out of time, I do want to acknowledge that some people are calling in or writing in with kind of the opposite emphasis.
Sure.
One listener writes, ask Willie Nelson. He may give you the answer for this subject. Listener writes, I use it to relax, and it's not as bad as drinking, which I have done for years. The THC content has been so much stronger with some dispensaries in my neighborhood. It's also not cheap. Gummies is the way for me now, but that person says they use it to relax successfully. Another listener asks, would your guest like to comment on benefits of cannabis use? So what do you say to listeners like those?
I hear this every time I write an article. It's very controversial. It's a big debate. There are obviously a lot of people who enjoy cannabis and benefit from it and don't see the risks, and they may not be having the risks. But we know from this survey that there's certainly a significant number of people. You're talking about 1 in 10 men over 18 who are having symptoms or acknowledging. This is self-reported. These surveys are self-reported. So they're asking people, do you feel like you should cut down and you can't cut down? Is this interfering with other parts of your life and you're not able to get away from it anyway? I mean, so we know that there's a significant number of people who are at risk. And of course, when you start using a substance, you don't always know which way you're going to go. And this may have to do with other issues in their lives. It may have to do with, we know with alcohol use disorder, there can be familial traits that make people more disposed. But I think we just have to be realistic. I think we're getting enough marketing telling us this is great. And I think we have to be looking out for what the downside may be.
The previous caller referred to what kind of federal categorization it still has, which makes it harder to get funding for the research that some of these things suggest might be needed. One more listener text. I'll give you a 30-second response, and then we're out of time. Listener writes, addiction grows when needs are not met. Let's stop demonizing substances. I'm
not sure what that person means, Brian.
Well, I think they mean alcohol
Sure.
isn't the problem, cannabis isn't the problem. The problem is enough people's needs are not being met in our society that they're going to turn to something, whether it's a substance or some other kind of coping mechanism.
Well, yeah, clearly. I mean, what's fascinating about this is that alcohol use is going down. We know that. We know that from sales. We know that from self-reports. Fewer Americans are drinking, and they're drinking less. The cannabis use is going up. So, yeah, we have a lot of stresses on us, and we have a lot of huge issues facing us as Americans in the world, and life is stressful.
Roni Caryn Rabin, health reporter for the New York Times, who just wrote a piece with the headline, "As More Americans Turn to Cannabis, Problem Use is Increasing," based on data that's been released. Thank you very much for joining us and discussing your reporting, Roni. We appreciate it.
Thank you.